This is known as the groove. This one right here. This is the groove of the trapezium bone. So this groove of the trapezium has got two lips. It has got a medial lip and a lateral lip. All right. As you can see, this way is medial, this way is lateral. So this portion right here has got the which one? So here is this is the lateral lip and here is the medial lip. So the deep slip of the flexor retinaculum would be attached to the medial lip of the groove of the trapezium bone. Alright, so those are the attachments of the flexor retinaculum. Now let us talk about the relations of the flexor retinaculum. So what do you mean by relations of flexor retinaculum? See, relations of flexor retinaculum, I'll be talking about structures passing superficial and deep to the flexor retinaculum. Alright, so I will show you, demonstrate this by drawing a diagram of the carpal tunnel. So I will draw the distal row of bones showing the attachments of the flexor retinaculum. So starting with, this is the trapezium bone with its crest, groove, etc. Then there comes the trapezoid, and this bone is the capitate bone, and then we have the hamate bone, right? So with the hook, right? So here is the flexor retinaculum extending from the crest of trapezium laterally to the hook of the hamate medially, and here is the deep slip which is attached to the medial lip of the groove of the trapezium bone, right? And we also have this superficial slip which would be attached to the pisiform bone. Okay, because it is in the proximal row, I'm not showing the bone pisiform here, but for the sake of reference, let's draw both superficial slip and the deep slip. So now you have an idea which is medial, which is lateral. So this is medial and this is lateral, and we've already drawn the flexor retinaculum with its superficial and deep slips and the attachments to the bones. Alright, now let us look at the relations. There are certain structures passing superficial to the flexor retinaculum. There are certain structures passing deep to the flexor retinaculum. So I want to begin with this structure here, that is the palmaris longus tendon. Okay, this is the tendon palmaris longus and it passes superficial to the flexor retinaculum. Alright, so this one here is the tendon of palmaris longus muscle. Now on either side of the tendon flexor palmaris longus we have two nerves here. So medially there is going to be the palmar cutaneous branch of the ulnar nerve, and laterally there is going to be the palmar cutaneous branch of the median nerve. So what are these two nerves? Medial one is the palmar cutaneous branch, this one right here. This is the palmar cutaneous branch of ulnar nerve, and this one right here is the palmar cutaneous branch of the median nerve. Those are cutaneous branches going to supply the skin of the hollow of the palm and a little bit of the concavity of the palm on the ventral surface. Now what else there is more laterally, that is lateral to the palmar cutaneous branch of the median nerve, there is going to be an artery. The artery is the superficial palmar branch of the radial artery. So here is an artery, that is the superficial palmar branch of radial artery, which is going to contribute to the formation of the superficial palmar arch. Therefore superficial palmar branch of the radial artery. All right, so these structures. Now more medially we have this volar carpal ligament, right, or the superficial slip of the flexor retinaculum. Now deep to the superficial slip of flexor retinaculum or the volar carpal ligament, we have two important structures here, one of them being the ulnar nerve, that is more medial, and lateral to it we have the ulnar artery. Right, so this one is the ulnar nerve, and this is the ulnar artery. So these many structures pass superficial to the flexor retinaculum, right? So here we have the hypothenar eminence muscles. So I'm showing in brown color. So this is hypothenar eminence muscles, and similarly on this side we have the thenar eminence muscles, which is bulkier than that of the hypothenar eminence muscles. So this is this is thenar eminence muscle, and on the other side is hypothenar eminence muscles. Now what are the other structures passing? Now we have this carpal tunnel here, right? This is called the carpal tunnel. Now what are the structures passing through the carpal tunnel? This is important. There is an important structure here just beneath the flexor retinaculum. We have this nerve called the median nerve. So median nerve is almost in the middle part of the carpal tunnel and just immediately beneath the flexor retinaculum. So what is this structure here? This is the median nerve. All right, now beneath the median nerve we have the tendons of the flexor digitorum superficialis and flexor digitorum profundus. Okay, in the proximal row of the carpal tunnel, these flexor digitorum superficialis tendons will be arranged as fours, meaning two above, two below. All right, so this row of flexor digitorum superficialis in the proximal part would be arranged like this. Okay, as they pass distally, these two of them come this side, two of them come this side, so that they become arranged like this. All right, because I'm drawing the distal part, I'm showing you the tendons arranged in a row. All right, so the superficial row here is the flexor digitorum superficialis tendons, four of them, and deep ones are the tendons of flexor digitorum profundus. All right, now more laterally we have the tendon of the flexor pollicis longus. This is flexor pollicis longus tendon. All right, let me erase this. Okay, right, now in this region here, that is deep to the flexor retinaculum, that is between the flexor retinaculum and the deep slip, we have a tendon here. This tendon is the flexor carpi radialis, tendon of flexor carpi radialis. Now these tendons are covered by the synovial sheaths of their own. Okay, now here we have this synovial pouch or the synovial sheath. This is a double layered that has got a peripheral layer and that is parietal layer and a visceral layer. So the layer that is close to the tendon is the visceral layer, and the one that is away from the tendons is the parietal layer. So this is the synovial sheath, that is the ulnar bursa. All right, so this structure in purple color is the ulnar bursa that is surrounding the tendons of the flexor digitorum superficialis and the flexor digitorum profundus. Now here is the radial bursa, which goes around the tendon of the flexor carpi radialis. The flexor pollicis longus. So this is the tendon of the flexor pollicis longus. Let me label it so it'll be easy for you to follow. This is flexor pollicis longus. Okay, and this superficial layer here, flexor digitorum superficialis, and these ones are flexor digitorum profundus tendons. All right, and this one also is covered by the synovial sheath. Okay, this is a synovial sheath that's covering. What is the tendon inside? It's the tendon of flexor carpi radialis. So here we have the flexor carpi, sorry about the uh, sorry about this not being very clear to you. Okay, so now I believe it is clear. So this is the flexor carpi radialis tendon. All right, so this one right here, this is, let me redraw this. Okay, so this one right here, this is the flexor pollicis longus. This tendon here is the flexor pollicis longus tendon. So these are the tendons that pass deep to the flexor retinaculum. All right, so four tendons of flexor digitorum superficialis, four tendons of flexor digitorum profundus, and then we have the one tendon of flexor pollicis longus. Whereas the tendon of flexor carpi radialis passes deep to the flexor retinaculum, between it and the deep slip of the flexor retinaculum. All right, so this is the relations of the flexor retinaculum. So let me brief the relations of the flexor retinaculum one more time. So when we talk about the relations of the flexor retinaculum, so we discuss this as the structures passing superficial to flexor retinaculum. So these structures include the ulnar nerve, we have the ulnar artery. These two pass deep to the volar carpal ligament, and the compartment that is formed between this superficial slip, this is medial, this is lateral, this is the superficial slip of flexor retinaculum, the deep slip of flexor retinaculum, and this structure is the flexor retinaculum. Now you get this compartment here, this compartment that is between the flexor retinaculum and the superficial slip of flexor retinaculum. This compartment is called the Guyon's canal. All right, so this particular region, that is for the ulnar nerve and the ulnar artery to pass, is called the Guyon's canal. All right, so passing through the Guyon's canal will be the ulnar artery and the ulnar nerve. All right, so when I'm listing these structures passing through the carpal tunnel, I'd like to write it as passing through the Guyon's canal, even though they are passing superficial to the flexor retinaculum, the actual flexor retinaculum, the flexor retinaculum here, the superficial slip, the deep slip. So the ulnar artery and the ulnar nerves. So truly speaking, the ulnar nerve and the ulnar arteries are passing superficial to the flexor retinaculum, but it is inside what is called the Guyon's canal. Now, what are the other structures? Further, we have the palmar cutaneous branch, of the ulnar nerve. We have the same palmar cutaneous branch of the median nerve. So here, please remember, the palmar cutaneous branch of the ulnar nerve passes medial to the tendon of palmaris longus, and the palmar cutaneous branch of median nerve passes lateral to the tendon of palmaris longus. Therefore, our fifth structure is the tendon of the palmaris longus. Tendon of palmaris longus. All right, and then we have the more laterally the superficial palmar branch of a radial artery. So these are the structures passing superficial to the flexor retinaculum. So let me demonstrate it one more time. So here is the tendon of the palmaris longus. All right, so this is medial, this is lateral. So here is the tendon of palmaris longus. Passing lateral to it is the palmar cutaneous branch of the median nerve. Passing medial to it is palmar cutaneous branch of the ulnar nerve, and more laterally is the superficial palmar branch of the radial artery. Now, what are the structures here? From medial to lateral, if you go, it would be ulnar nerve, ulnar artery, palmar cutaneous branch of the ulnar nerve, tendon of palmaris longus, palmar cutaneous branch of the median nerve, and the superficial palmar branch of the radial artery. So these are the structures passing superficial to the flexor retinaculum from medial to lateral side. All right, now let us look at the structures passing deep to the, so the second heading here is structures passing deep to flexor retinaculum. The structures passing deep to the flexor retinaculum. So we have the tendons of the flexor digitorum superficialis. Flexor digitorum superficialis. How many of them? 4 tendons. In the proximal part, they will be arranged in 2 rows. The 4 tendons would be arranged in 2 rows. And in the distal part, they are arranged in a single row. And also we have the tendons of the flexor digitorum profundus. Flexor digitorum profundus. All right. Further, we have the tendon of the flexor pollicis longus. All right. And then remember, all these tendons would be covered by synovial sheaths. There is a common synovial sheath for the tendons of flexor digitorum superficialis and profundus. The tendon of that is called the ulnar bursa, and the tendon of flexor pollicis longus is covered by what is called the radial bursa. Okay, radial bursa. This is the synovial sheath. And one more deep structure would be the median. So this is the most important structure of the carpal tunnel. All right. Now the structures passing deep to the between the flexor retinaculum, and the deep slip of the flexor retinaculum would be just one tendon, that is the tendon of flexor carpi radialis, and it is covered by its own synovial sheath. All right. Now, right. So this is about the flexor retinaculum, its attachments and structures. Let's just take a look at the flexor retinaculum in this video, in this 3D atlas. So here's the flexor retinaculum. All right, this is the flexor retinaculum with its attachments. Right. So medially we have its attachment to the pisiform bone and to the hook of Hammett, and laterally it is attached to the scaphoid, tubercle of the scaphoid and the crest of the trapezium bone, and deep to it we have this carpal tunnel due to the concavity of the carpal bones. That's how they are arranged. Now passing superficial to the flexor retinaculum, so from medial, so little finger side to the thumb side, so we have the palmar cutaneous branch of the ulnar nerve, and this is the ulnar nerve itself. This is the ulnar artery, and then we have the
to do that, you'll need to turn off air.
This is the palmaris longus.
To do that, you'll need to turn off airplane mode.
Yeah, thank you. Thank you, Siri. Thank you. So this is sorry. So these are the structures passing superficial. Now there is one more superficial structure, lateral antebrachial cutaneous nerve. This is the lateral cutaneous nerve of the forearm. This is far beyond the limit of the flexor retinaculum. It goes far to the lateral side. So it is no way related to the flexor retinaculum. Now, deep to the flexor retinaculum, we have all these tendons here. The tendons of the flexor digitorum superficialis muscle, the tendon of the flexor digitorum profundus, and the flexor pollicis longus and flexor carpi radialis tendons, the flexor carpi radialis tendon. So, that's about the flexor retinaculum, the attachment of the flexor retinaculum, and the relations, the superficial and the deep relations of the flexor retinaculum. Now let us talk about something called the carpal tunnel syndrome, which is very important. Now, what is carpal tunnel syndrome? This is due to the entrapment entrapment of the median nerve, right? And basically entrapment of the median nerve and the compression of the median nerve following that. Okay, so this is by the long continued swelling of the synovial sheaths. We know there is ulnar bursa, there is radial bursa, right? So whenever there is an inflammation, infection of the synovial coverings of these tendons, or the overuse of the muscle, or due to an infection, maybe a needle prick, that can give rise to some kind of infection there. So it will result in the compression of the median nerve in the carpal tunnel. And also people who use the mouse for keep the palm basically on the table for a very long time, people, the IT professionals especially, who keep their palm resting on the table when they are working with their laptops, right? On the their flexor retinaculum is constantly compressed, and it gives rise to the compression of the median nerve, giving rise to the symptoms of carpal tunnel syndrome. So basically the fact you should understand here is that the median nerve passes deep to the flexor retinaculum. So the continued compression of the flexor retinaculum, that could be due to any external pressure or due to the inflammation of the synovial sheaths covering these long tendons. No matter which, the median nerve is going to be compressed and going to give rise to some symptoms. All right, so this is basically manifested by weakness of and also there is weakness and wasting of the thinner muscles, right? Because we have these thinner muscles getting supplied by the recurrent branches of the median nerve. There is also a loss of opposition because the opponens pollicis muscles are weakened. So the thinner eminence muscles such as the abductor pollicis brevis, flexor pollicis brevis, opponens pollicis, all these muscles are weakened, and therefore the thumb cannot function properly. Right, and there is also loss of opposition that gives rise to something called the ape thumb deformity. Ape thumb deformity, because flattening, as you can see in this picture, there's flattening of the thinner eminence due to the compression of the median nerve. All the muscles undergo wasting and weakness, so you cannot perform the actions of the thumb. Therefore opposition is lost and the thumb lies flat, just like the thumb of apes, okay, where opposition is very minimal or there is no opposition at all. In addition to this, there will also be loss of cutaneous sensations of the palmar surface, okay, involving the lateral 3.5 digits, because we know the lateral 3.5 digits are supplied by the cutaneous branches coming from the median nerve, like this, right? So 3 proper digital branches and 2 common digital branches, they come from the median nerve to supply the skin of the lateral 3.5 digits. So this is also lost. All right, so that is about the carpal tunnel syndrome. So what is carpal tunnel syndrome? Is the compression of the median nerve or entrapment of median nerve and its compression in the carpal tunnel by the long continued swelling of the synovial sheaths. It can also be by compression of in the anterior aspect of the wrist. Okay, so there will be weakness and wasting of the thinner eminence muscles with the loss of power of opposition and also loss of cutaneous sensation of the on the palmar surface of the lateral 3.5 digits. And this condition is also known as the ape thumb deformity. Okay, that is due to the injury of the median nerve. So injury of the median nerve gives rise to what is called ape thumb deformity. All right. So this is about the flexor retinaculum and the carpal tunnel syndrome. All right. So I hope this was helpful to you to understand what are the attachments of the flexor retinaculum and what are the structures passing superficial to and deep to the flexor retinaculum. And I'm glad if you understood the concept. And yeah, thank you. That's all I wanted to share with you. Thank you very much.